Yeah. Senate Bill 739 is, something that we're trying to take from a local level and expand it statewide, and that is guaranteed income for transitional age foster youth. It's something that, I had the experience of introducing about a year ago in Santa Clara County when I was a county supervisor down there. I later got elected to the state Senate in November, and I've been here, for several months. But one of the bills I wanted to introduce was this bill, 739, to see what we could do for the 2,500 transitional age foster youth that are aging out and really have a pretty rough landing spot right now, especially with the pandemic going on.
So tell me what's the need for this bill and why you feel it's important to get this passed now?
Well, transitional age foster youth, first and foremost, are essentially the children of the state, and by way of the state, the county. So there are kids. They fall on tremendous hardship as it is. Typically, the system hasn't been working very well for them over the years. But we've especially seen during the pandemic, just a couple months into shelter in place last summer, about 23% of the foster youth, transitional age foster youth, said they had missed a meal. Almost 25% of them were having tremendous difficulty with housing, essentially had lacked housing. About 50% of them said that they were struggling to just have a place to live. They had no family to fall back on. So these are statistics that we see just in terms of surveys that are done among the foster youth themselves. The other issue that we run into is not so much words coming from their own mouths, but the statistics and the data that we have with this particular population, because of the fact that they've been essentially part of our child welfare system their entire lives. We know that they have a 50% high school dropout rate, which is unacceptable, of course, and the state and counties are trying to help with that. We know that they make up a significant portion of our homeless youth, and those statistics are readily available. So this approach basically says, let's try something different. Let's try empowering them by giving them a stipend of $1,000 a month, which we firmly believe, especially based on our local county experience over the past year, will keep a large percentage of them out of the systems that we want them to stay out of, like the justice system or our homelessness prevention areas. These are areas, our mental health population, these are areas where foster youth, especially at this transitional age, tend to find themselves, and it ends up costing counties and the state, a lot of money indirectly to have this kind of recidivism of foster youth coming back into the system over and over again. And so many people say, well, if it's housing, why not just give them a housing stipend? Or if it's books or tuition, why not just give them an education stipend? Or if it's food, why not give them food vouchers? If it's mental health care, why not just give them some kind of health insurance? What the guaranteed income does is it says we recognize the fact that you're not all in the same situation. Some of you are suffering from anxiety around lack of food and nutrition. Some of you are just in need of maybe a $500 a month or $1,000 a month to get that housing because you have a job and you have food, you just don't have a place to stay. So what this bill says is, let's not dictate or try to be smarter than thou and tell them, we know what you need. You're all going to get a housing voucher, for example. Let's say, here's the $1,000, just like a transitional age youth in a middle income or upper income family might get. Here's some support. Use it as you see fit based on your own unique needs. And that not only empowers them, which is very important, but allows them to be a little more surgical with their own money in terms of where they really need it. We think it's been a great pilot in Santa Clara County. The idea here is to run a 3-year pilot at the state, and if we're wrong and it doesn't work, the pilot will end, but I think it's going to work.
Is the 2,500 kids aging out, is that just the annual number in California, or do you know what the annual number is?
We know what the number is based on a lot of research, and even the bill analysis, the legislative analysis from the Appropriations Committee on this bill, indicates it's between 24 and 2,500 who are 21 years old, approximate, who are aging out, at that age, and essentially do no longer, have family support to help them out. That can fluctuate, of course, year to year, but we don't think it's going to fluctuate that much over the period of this pilot, over the next 2 to 3 years.
Where will the money come from to fund this program?
Great question. One of the things that we get to do as legislators, of course, besides introduce new ideas or new laws or new legislation, is we also are empowered to make budget requests. And there is a corresponding budget request that's separate from this bill that seeks about $30 million a year for the 3 years of the pilot to get this program stood up and funded. We believe in this year, as I think everyone knows, this is a year of surplus, a year the governor has called a once-in-a-lifetime opportunity. And, obviously that amount of money pales in comparison to a $38 billion surplus. And we know that the governor's office, having brought in Michael Tubbs, the Stockton mayor who first launched guaranteed income in the United States, is now working in the governor's office. So we know there's a lot of momentum there. We know that there's a likelihood that we can get this funded through some combination of this California State Senate and the governor's office, just making sure that money's in the budget.
You mentioned the budget surplus. Is there a possibility, or you think there's a better chance that this bill passes because of the large budget surplus and the extra money being around?
I think the bill could have passed subject to appropriations. That happens sometimes where something is viewed as a good legislative idea, but nobody knows where the money's going to come from. And in tough years, sometimes that happens, and you end up with a bill that just really tries to stand up a program, but it never works because the money never is realized or recognized in the budget. To answer your question, in this case, we appear to have the best of both worlds. Legislative support. I mean, this sailed right out of out of committee. It's as I said, it's in appropriations now, but it's highly prioritized by my office in appropriations. It's been viewed as a priority up to this point in the budget subcommittees of the state Senate. And yes, we know that the governor's office is looking at programs like this is very important, not just because they provide safety net during the pandemic, but because we have a governor who's looking to make change in the state of California permanent.
How did the program work in Santa Clara County?
In Santa Clara County, there were 72. Obviously, it's one county out of 58, so we didn't have 2,500 to deal with. We had 72 transitional age youth. The transition age was treated a little bit differently based on the population there of youth and an extended program that exists in Santa Clara County to support youth a little bit longer than what we typically see at the state level. But it's worked well. It's worked without a hitch, really. In fact, the support testimony that we had at the committee level, at the policy committee level, when we were moving this bill along, was brought forward by the Behavioral Health Department of the County of Santa Clara, who runs the program along with social services. And it's the foster youth themselves, of course, that are probably our best witnesses, our best testimony to this bill. But really not a problem with people complaining or dropping out of the program or falling out of the program or misusing money or anything like that. And early on, the administration was a question, like, how do we actually get the money to them? Do we have to set up a separate payroll system or something? And then, technology took over at that point, and they figured out all they really had to do was give them, a controlled debit card that the money can be dumped into, so that, again, they're not restricted. The whole idea here is to get away from these prescriptive policies of the past that try to say, hey, the government knows best, what you need. What they need is support and the ability to make decisions about those dollars. And if there was no other reason to try this, it would be the fact that the failed policies of the child welfare system and foster support that have been very prescriptive over the last 3 or 4 decades have failed. We wouldn't have these enormous problems with foster youth landing in these systems that we don't want them to land in, like the justice system, if the system was working. So it's time to try something different.
Outside of Santa Clara County, are there any similar programs like this in the country that you're aware of?
This would be the first program of its kind in the country. It's certainly the first statewide program. The program in Santa Clara County was the first in the nation to use UBI, or guaranteed income, on this demographic, this foster youth demographic. There are a bunch of UBI programs starting to pop up, particularly in cities, not only in the state, but in the country. Counties and cities like Oakland, for example, are trying to replicate one way or the other something similar to what Stockton did. But this would be the biggest program with the most breadth and across the board, as far as I know, of any program. I don't know of a UBI program that would immediately positively impact the lives of 2,500 persons, human beings, each and every month, anywhere. And certainly that would be a big program for a city, but we don't even have a state that has a program that big at this point.
So what are the next steps for this bill in the legislature?
Well, we need to get it out of appropriations. We'll know that around May 20th of this month. That's a very powerful committee that, again, gets to make the decision. Should this go forward, subject to the money appearing in the budget? We might know better 5 days before appropriation makes that decision. We get the May revise, the governor's May revise. There may be some indication there of dollars being available. We'll see. And the Senate will be making its own recommendations, legislative recommendations on budget. And I'm really hoping that we have a better read on that before appropriations makes their decision. But we get it out of appropriations, and then it starts going to floor votes. It needs to go to the floor of the Senate. It needs to go to the floor of the Assembly. If there's significant amendments, of course, it'll come back for us to look at one more time. There's really no opposition to the bill, and nobody's nitpicked it for amendments at this point. So we think if we can get it onto the floor of both houses, we have a pretty good shot at getting it through. And like I said, then it's just a matter of, is that money in the budget or not? And we'll keep working at that.
If it's passed, how soon could it be implemented, or when would you like to see it implemented?
Based on our Santa Clara County experience, we think it could be implemented as quickly as just a few months. We'd like to see it be a today deal. We'd like to see it be a 2021 funding mechanism for these youth, certainly as soon as possible. We have worked closely with the state social services department in that regard. They seem to be embracing it. They seem to feel like they understand how to do it, how to stand the program up quickly, how to vet the program and make sure that, obviously the right youth are getting the money. But it's so much easier than something like regular stimulus money, where you aren't even sure who's going to show up. Here we know who this population is, name, rank, and serial number. It's pretty easy to go into a database and figure out where the 21-year-olds are that are transitioning out of the systems, which makes it pretty easy to implement, getting the debit cards to them and getting the money to them. So we'll keep pushing for a quick implementation.
What would you like to see happen to this program after the 3 years is up?
Well, first of all, I'd like to see it continue, of course. And I think, I believe firmly that the results will not only support it being continued, but it may just show that this is a revenue neutral program. When you start taking those back end costs out of the program, out of the state's budgetary program, you know, when less of these foster youth are coming in for mental health services or ending up in jail or in our justice system or on probation, I mean, it starts cutting costs that you don't want to see. And, you know, we think that'll be part of the equation. But the other thing I want to see is I'd like to see this applied to other demographics thereafter. I mean, the idea isn't just philosophically that this kind of an approach to social services should only be in the child welfare system or the foster system. This idea is broader than that. It says, you know, when you tell people that you can only have food stamps for food, they're going to come and get it, but it may not be what they need, what kind of resources they need at that particular moment. People in poverty, they may need more flexibility with their dollars. They may need shoes for their kids. They may need a Wi-Fi connection so they can get telecare for their kids. Why should we be saying to people, the only thing you're going to get, you know, is food stamps or some sort of very prescriptive social service assistance, when the fact of the matter is they need to make decisions like every other household in California that are best for them and their family. So I'd like to see that this creates the kind of trust among the people of the state of California where they say, you know what, if that works so well for that population, hey, maybe we ought to push it out and start including some other populations. How about the disability population? You know, how about kids who are autistic who have to transition out of their family's households at some point and need some extra services? Shouldn't they be able to decide how to use $1,000 a month rather than have somebody in the welfare system, so to speak, dictate that to them? So this is the future, I hope, but we'll see.